Hello, everybody. Welcome to our presentation on medicine in Roman times. In this presentation, we will talk about the medicine and how it was different between the, the social classes.
Roman physicians and scholars had made such a significant push forward that it would be the most dominant era for medicine for centuries to come. A lot of today's medical knowledge was first discovered in Roman times.
The Romans' approach to medicine was largely religious, but was also partly fundamental. A lot of Roman medicinal herbs and practices revolved around the gods and other beliefs.
Most of the Roman medical knowledge was derived from the method of several conquered communities, such as the Etruscans, the Egyptians, Persians, but especially the Greeks.
Roman medicinal practices were often based around religious practices and beliefs, and involved tools in holistic medicine that connected to the practices and beliefs.
Ancient Romans had several painkillers for surgery, such as morphine and scopolamine, which allowed them to practice and use a multitude of surgery methods on patients.
Despite not knowing the role of germs and diseases, the ancient Romans knew and used many techniques to kill off germs. These techniques were not reinvented for a long time, and many of today's methods for this were derived from the Roman practices.
The Romans had an abundance of different surgical tools. The most prominent ones were scalpels, bone hooks, bone drills, forceps, bone levers, vaginal speculums, rectal speculums, male catheter, and probes or Kutcha.
Many of today's surgical instruments have been derived from these ancient instruments, which show an impact ancient Rome and surgical treatments have had on modern surgery. Some of the most common and useful medicinal herbs and their responsive purpose include fennel. It was thought to have calming properties. Elecampane, used to help with digestion. Sage, although it had little medical values, it had great religious value. Garlic, beneficial for the health, particular for the heart. Fenugreek, used in treatment of pneumonia. Sulfin, used for a wide variety of ailments and conditions, and especially for birth control. Willow, used as antiseptics.
Professional medical treatment was expensive, so ordinary people used herbal medicine and resorted to asking the gods for help. Many of these practices were derived from the Greeks when Greece was conquered by Rome. Galen was a famous figure from the Roman times.
He learned from his dissections how humans fit together and gave the Romans a significant amount of medical knowledge from his studies. The Romans developed the first ever system of public health, which was inspired by public health systems we have today. The need for a healthy army led Romans to think about public health. The capture of slaves brought Greek doctors to Rome. The Roman army developed some of the earliest hospitals. Anatomical and surgical skills developed as many doctors treated war wounds. Three important factors combined to use them to create a public health system: their suspicion of Greek doctors, their realization, and the army needed hygienic conditions to keep their soldiers healthy, and their engineering abilities. The ancient Greeks also introduced other medicinal treatments to the Romans, such as unwashed wool, used for sores. Egg yolk was given to patients with dysentery, and boiled liver was administered to patients with sore eyes.
The Romans were great builders, and among their amazing constructions were aqueducts, baths, sewers, and hospitals. This allowed them to create their incurable public health systems.
Galen is the most famous Roman doctor, advocated the healing power of nature, and uses the opposite, example hot pepper, to cure a cold, and cool cucumbers to cure fever. Aside from Galen, there were many other incredible Roman doctors, and the Roman era of medicine provided to be one of the most revolutionary pushes in medicinal science of times.
Thank you for watching.
Thank you.